Some of the other types of hernias that people might have heard about other than abdominal wall hernias is you can have what's called a hiatal hernia. And the way I describe that to people is you have your chest cavity and your abdominal cavity, where you have a hose that goes from your mouth to your stomach that carries your food. You have a muscle that separates your chest from your abdominal cavity called your diaphragm. Well, if you have a muscle separating the two cavities and a hose that goes through it, there has to be a hole in that muscle. And a hiatal hernia, or sometimes it can be even bigger, it's called a paraesophageal hernia, is where the stomach sneaks up through that hole and part of your stomach is in your chest. And that usually presents itself with difficulty swallowing, very nasty acid reflux, or some discomfort in the chest. Most of the time, the primary care providers will start people on acid suppression medications. Proton pump inhibitors is the first line of medication for that. And then it usually ends up where you end up having an upper endoscopy to look down into your esophagus to see if some of your stomach has actually come up above your diaphragm. And then after that, they usually end up seeing me. Robotic makes it so I have better visualization. It lets me do a much cleaner operation with much less pain. And then the best part about doing this on the robot is I have to dissect the esophagus within the thoracic cavity, and it lets me get much higher into the chest, which leads to much lower recurrence rates.